A lot of times genetic and genomic testing are used interchangeably, but the way I think about the two types of testing are, for me, it's different. So genetic testing is looking at a lot of times the inheritance of patterns of different genes and how they may relate to cancer. So an example would be for breast cancer, a genetic test that we would do would be BRCA, looking at BRCA expression in terms of determining whether if you have that gene, you're at risk for breast cancer. In colon cancer, it's doing specific genetic testing to see whether or not you're at risk for something called Lynch syndrome, which is a type of defect in a gene that makes one at higher risk for developing colon cancer. So genetic testing I think of as inherit testing for inherited or hereditary diseases. Genomic testing, I think of as testing that is done on one's tumor sample. So it's, that tumor may have a genetic basis, meaning it may have been inherited, but genomic testing is done specifically on a patient's tumor sample to help look at different genes that may be involved in how that cancer developed, or potentially as targets for treatment down the road. So that's the way I differentiate it in my mind, and it sometimes is used interchangeably, which makes it confusing for people. But genetic testing, I think of as trying to see whether or not a disease is inherited, and genomic testing, I think of as testing that's done on one's tumor sample that may help with treatment approaches down the road.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.